Okay, so apart from these structures which we have discussed now, you also have the structures of the posterior abdominal wall, which includes the muscle of the posterior abdominal wall. So you have to know what are the muscles of the posterior abdominal wall. We have already discussed about the diaphragm. So you have to identify the diaphragm, the right and the left crux of the diaphragm, the major openings of the diaphragm. So this is one muscles. Apart from the diaphragm, we have another 4 muscles. One is this very important muscle. This is psoas major, and then we have lateral to the psoas major, we have quadratus lumborum. This muscle you can see, this is the quadratus lumborum, and then this one is the iliacus. Apart from the psoas major, quadratus lumborum, and iliacus, we also have the psoas minor muscle, which is not present here. So this is about the posterior abdominal wall muscles. Apart from posterior abdominal wall muscles, you might be asked about the blood vessels. So we have this abdominal aorta with anterior branches and the lateral branches, like this is celiac trunk, this is superior mesenteric artery, and this is inferior mesenteric artery. This is inferior vena cava, with we have this the left renal vein, which is crossing anterior to the abdominal aorta. This is the right renal vein. And then you might be asked about the tributaries of the left renal vein, like say in this case it is suprarenal vein draining, and this is the gonadal vein draining inside the left renal vein. So this is on the left side, which is different from the right side. So again, I'm repeating the tributaries of the left renal vein. Now, apart from the muscles and the blood vessels, you might be asked about the nerves of the posterior abdominal wall. And for this, you need to go to the picture, the image which we have already shared with you. And what they're going to ask you from the lumbar plexus, they're going to ask you to identify the branches. Say, for example, iliogastric, iliohypogastric, ilioinguinal, the femoral, obturator, genitofemoral nerves. These are the branches of the lumbar plexus. There is one important thing that I want to stress upon, that this muscle is very important with respect to the different branches of the lumbar plexus. We have some branches which are running laterally. In fact, most of the branches running laterally to the psoas major. There is one branch which pierces the psoas major and comes out anteriorly, that is genitofemoral nerve. And then there is one nerve which moves medially, is the obturator nerve. So you have to know the different branches of the lumbar plexus. Thank you.